For many, having a baby comes with great concern that their baby will inherit genetic disorders that run in the family. As a survivor of congenital heart disease myself, I too worried about passing along a heart defect. Now there's a way to test for and prevent such issues. Here with more, Dr. Arrach. Good evening and welcome back.
Hi, good evening.
All right, so tell us why this testing is so important in all of this technology that we're seeing today.
Well, as you may know, we were able to test for one single condition with the older technology. Now with next generation sequencing, you can test for more. So essentially you can look for one particular condition, inherited condition, but you can test for some inherited cancer forms or metabolic disorders. It's the power of next generation sequencing is so huge that you can essentially look for anything that is of concern.
Now, for viewers who don't know a lot about this, when we say we're testing, we're talking about testing an embryo. So a family would do IVF and you're creating an embryo outside of the human body. That's when you test that embryo for cancers that might run in the family. In my case, I did it for heart disease. And then you're implanting that embryo into the mother's uterus.
That's right. So when we receive a biopsy of one embryo that is planned to be transferred, they want to know if that embryo is chromosomally normal, but you can test for more than that. You can look for example, for a number of inherited cancers that the family may have been affected with or they may be aware of. You can test for essentially any genetic condition that is inherited.
This is so important because not only could it be detected, but we're talking about once these are detected, some of these diseases that are passed down through the family's cancers, heart disease in my case, could be removed from that embryo before implantation. Essentially
what the laboratory testing we do is we look at the embryos that don't have that condition, and those are the ones that are selected to be transferred. The ones that have condition obviously will not be used. So you're not removing a condition, but you're choosing the embryos that don't have the specific conditions that you're looking at.
Because those embryos would be genetically abnormal.
Correct.
Okay.
Correct.
There's so much more to talk about on this topic. It's one of my favorite topics, very close to my heart, and perhaps we could have you back on the show again. We are flat out of time, but thank you so much, Dr. Arrach, for being with us again.
Thank you.
All right.